So today we're going to discuss the arterial, venous, and PA catheter blood sampling. So we need to gather all the equipments first before we do the procedure. This includes the ABG kit, the blood tubes, the vacutainer, alcohol pads, flushes, and we also need the gloves, the sterile gloves. So this patient doesn't have a PA catheter, but we have sample here. When we do a blood sample, we need to educate the patient. We need to get a consent from the family member. And we need to do an assessment, including the hemodynamics. Patient preparation is also important before we do the procedure. So similarly, we draw the blood from this container. We aspirate this slowly to prevent, it's important to prevent a mix, to prevent any contamination of the mixed venous sample with arterial blood from the pulmonary capillaries that will actually falsely elevate the SbO2 value. So aspirate it here, and we use the ABG kit to draw the blood from this area and slowly aspirate it. And after that, you slowly push the blood back so there's no wasting of blood using this method. So the unexpected outcomes for this is a clotting of PA catheter and also inability to obtain SbO2 sample, and also emergency findings can have a bleeding. So make sure that you close all the caps and make sure that you check your patient, monitor your patient after the procedure. So after this is the arterial and central venous sampling. Thanks. Ready? So first, we have to turn off the alarm of the A line so it will not alarm, and make sure that it's in the position is correct. And then we're gonna draw. This line has a port in here that you can just draw without wasting the blood. Okay, so just draw the blood slowly. And once this container is filled, you just close this area. And then make sure that you disinfect this with alcohol. And get ready with your vacutainer. So already disinfected that area. And then this tube is for CBC sample. Okay. And then just take off. Then you have to make sure that you put the blood back. So special consideration, make sure that the sharps is on a sharp container after your procedure, and you have to flush this so the blood will not clot. And after the procedure, make sure that you label the sample with a proper labeling and the time and date. So that's it for A line. Thank you so much. Okay, so now we're going to do a central line blood sampling. So here we can get venous blood gas. Okay, this patient has 3 ports. So first, we want to make sure that there is a blood return. We're gonna flush it, and then we're gonna check if there's a blood. Okay, so you want to disinfect the area to prevent infection. Okay, now flush it, and then so there's a good blood draw. We usually take 5 to 10 cc of waste, and then we prepare the vacutainer to draw the sample. So this is easier. You just connect it here and then get the tubing.
Green, usually we send it for BMP, potassium, or mag, and then just connect it. And then that's it. After this, we have to flush the area, and then disinfect it again and flush the area. And then put the cap screws, and then just make sure that it's locked. Okay, so that's the procedure for arterial and central line sampling. Thank you.